pass stool, voiceover ready script, stuck poop in the rectum, causes, symptoms, home remedies, and when to see a doctor. Imagine this. You're sitting in the bathroom. You feel the urge. You know something needs to come out. But no matter how hard you push, how long you sit there, how much you strain, nothing happens. Your stomach feels heavy. Your lower belly aches. And deep down, you feel that stool is right there, stuck, refusing to move. If this has ever happened to you, you are not alone. In fact, did you know that nearly 1 in 3 adults over the age of 60 silently struggles with this exact problem? And here's the part most people don't realize. Ignoring it for too long can lead to a dangerous medical emergency. So before you reach for another laxative or try one more home trick that doesn't work, stay with me. Because in the next few minutes, I'm going to share with you exactly why this happens, the warning signs your body is giving you, the safe home remedies that actually work, and the moment you must call your doctor. This could be one of the most important health videos you watch this year. Hello, my friend, and welcome back to the channel. If you're new here, this is the place where we talk openly, honestly, and with care about the health concerns that matter most to seniors and the families who love them. Today, we're talking about something many people feel too embarrassed to discuss, even with their own doctor. Stool stuck in the rectum. Yes, I know it sounds uncomfortable. But here's the truth. Constipation and what doctors call fecal impaction affect millions of older adults every single year. And for many of them, it doesn't stay a small problem. It becomes painful. It becomes frightening. And in some cases, it lands them in the emergency room. Why does this matter so much after age 60? Because as we get older, our digestive system slows down, our muscles weaken, the medications we take, the foods we eat, even the amount of water we drink each day, all of it begins to affect how easily our body can pass waste. So today, I'm going to walk you through everything you need to know, the causes, the symptoms, the home remedies that are safe and gentle, and the red flags that mean it's time to stop waiting and get help. Grab a glass of water, get comfortable, and let's begin. Let me ask you something. Have you ever noticed that bathroom trips just aren't what they used to be? Maybe in your 30s and 40s, your body was like clockwork. Every morning, like clockwork, things just worked. But now you might go a day, maybe 2, maybe even 3, and nothing. Here's why. As we age, several things change inside our body. First, the muscles in our colon and rectum become weaker. These muscles are responsible for pushing waste out. When they slow down, stool sits longer in the colon, and the longer it sits, the harder and drier it becomes. Eventually, it gets so hard that it simply cannot pass on its own. That's when it gets stuck in the rectum. Second, many seniors take medications that cause constipation as a side effect. Pain medications, especially opioids, blood pressure pills, antidepressants, iron supplements, even certain antacids. If you're taking more than one of these, your risk goes up dramatically. Third, we tend to drink less water as we get older. Many seniors lose their sense of thirst, so they sip a little here, a little there, and end up dehydrated without even realizing it. Without enough water, your stool becomes dry and difficult to pass. Fourth, our diets often change. Maybe chewing is harder now. Maybe cooking feels like too much work. Maybe fresh fruits and vegetables aren't on the grocery list as often as they used to be. Less fiber means slower digestion. And finally, we move less. Walking, stretching, and even gentle movement helps our digestion. But when we sit for hours in front of the TV, in a recliner, in a wheelchair, our intestines slow down too. Now I want you to think for a moment. How many of these apply to you or someone you love? Even 2 or 3 of these factors together can be enough to cause stool to get stuck. Now let's talk about the signs. Because here's the truth. Many seniors ignore these warning signs until it becomes an emergency. Please listen carefully, because recognizing these early can save you a lot of pain, and possibly your life. Sign number 1. You haven't had a bowel movement in 3 or more days. This is one of the clearest signals that something is wrong. Some people brush it off and say, "Oh, I'll go tomorrow," but 3 days is the line. After that, the stool starts hardening fast. Sign number 2. You feel a constant urge to go, but nothing comes out. This is your body telling you that stool is sitting in your rectum, ready to come out, but it's too hard or too large to pass. It's a frustrating, helpless feeling, and it's a major warning sign. Sign number 3, lower belly pain or bloating. Your stomach may feel swollen, tight, or tender. Some people describe it as feeling like a balloon inside their belly. This happens because gas and waste are backing up. Sign number 4, small amounts of watery stool or leaking. Now this one surprises many people. They think, if I'm having diarrhea, I can't possibly be constipated. But actually, when stool is stuck, liquid stool from higher up in the colon can leak around it. Doctors call this overflow diarrhea, and it's a strong sign of impaction. Sign number 5, nausea or loss of appetite. When waste backs up in your system, your whole digestive process slows down. You may not feel hungry. You may even feel queasy or want to throw up. Sign number 6, feeling tired, weak, or confused. Yes, even confusion. In older adults, a backed up bowel can affect the entire body. Some seniors become disoriented, dizzy, or unusually exhausted. Sign number 7, rectal pain or bleeding. If you see blood when you wipe, or if you feel sharp pain in your bottom, please don't ignore it. This can mean the hardened stool is damaging the delicate tissues of your rectum. If you have even 2 or 3 of these signs, please take them seriously. Your body is trying to tell you something. If you're over 60 or if you're caring for an elderly loved one, this information could truly be life-saving. So before we go further, do me a small favor. Pause for just a moment and share this video with someone you care about. A spouse, a sibling, a friend at church, an adult child caring for an aging parent. You never know who might need to hear this today. And if this channel has helped you, please hit that subscribe button. It means the world to me, and it helps us reach more seniors who need this kind of caring, honest information. Now let's talk about what you can actually do about it. All right, let's get to the part you've been waiting for. What can you do at home, safely and gently, when stool feels stuck? Remedy number 1, drink warm water first thing in the morning. This is one of the simplest and most powerful tricks. A large glass of warm water, 8 to 12 ounces right after waking up, helps stimulate the natural movement of your intestines. Some people add a slice of lemon, others drink warm prune juice. Both can work beautifully. Remedy number 2, add fiber, but add it slowly. Fiber is the secret weapon for healthy bowel movements. But here's the trick. If you add too much too fast, you can actually make bloating and gas worse. So start gentle. Add a handful of berries to your breakfast, a spoonful of ground flaxseed in your oatmeal, a small bowl of bran cereal. Cooked vegetables like spinach, carrots, or zucchini are easier to digest than raw ones. And don't forget prunes. Just 3 or 4 prunes a day can work wonders. Remedy number 3, move your body, even just a little. You don't need to run a marathon. A 10-minute walk after each meal, gentle stretching while sitting in a chair, even marching in place for a few minutes. Movement helps wake up your digestive system. Many seniors notice improvement within just a few days of adding light daily activity. Remedy number 4, try the right bathroom position. This one surprises people. Our modern toilets are actually not ideal for passing stool. Try placing a small stool or footrest under your feet so your knees are higher than your hips. This position straightens out your colon and makes it much easier for stool to pass. Lean slightly forward, rest your elbows on your knees, and breathe deeply. Don't strain, don't force it. Just let your body do its work. Remedy number 5. Use a gentle, doctor-approved stool softener. Now, I want to be very careful here. Not all laxatives are safe for seniors. Avoid harsh stimulant laxatives unless your doctor specifically recommends them, because long-term use can actually make constipation worse. Instead, ask your doctor or pharmacist about gentle options like a fiber supplement, a stool softener, or an osmotic laxative. These work with your body, not against it. Remedy number 6. Try a warm bath or abdominal massage. A warm bath can relax the muscles around your rectum and make it easier for stool to pass. And a gentle clockwise massage of your lower belly, starting from your right side and moving across to your left, can help guide stool along its natural path. Do this for 5 to 10 minutes. Many seniors find this very soothing. Remedy number 7. Stay consistent with your bathroom schedule. Your body loves routine. Try sitting on the toilet at the same time each day, ideally about 20 to 30 minutes after a meal. That's when your digestive system is most active. Even if nothing happens at first, your body will start to remember the rhythm. These remedies are gentle, safe, and effective for most seniors. But, and this is important, they are not meant to replace medical care when the situation is serious, which brings me to the next part. Now, please listen very carefully to this part. There are certain moments when home remedies are not enough and waiting can be dangerous. Call your doctor right away if you experience any of the following. If you haven't had a bowel movement in more than 5 days, even after trying home remedies. This is no longer just constipation. This could be fecal impaction, and it often needs medical treatment to safely remove the stool. If you have severe abdominal pain, especially pain that's getting worse, not better, this could mean the stool has caused a blockage, which is a serious condition. If you're vomiting, especially if what you're throwing up looks dark or smells unusual, this can be a sign that your intestines are completely blocked. Please go to the emergency room. If you see significant blood in your stool, or if you're passing black tar-like stools, this can mean bleeding somewhere in your digestive tract. If you have a fever along with constipation, a fever combined with bowel symptoms can indicate an infection or inflammation that needs immediate attention. If you feel weak, dizzy, confused, or lightheaded. In older adults, these symptoms can sometimes be the only signs of a serious problem. And finally, if you have a history of heart disease, diabetes, or take blood thinners, please be extra cautious. These conditions can make bowel problems more dangerous, and your doctor needs to be involved sooner rather than later. I want you to remember something. There is no shame in this. Doctors deal with these issues every single day. They will not judge you. They will not laugh. They will help you. So please, never let embarrassment stop you from getting the care you deserve. Now that we've talked about what to do when stool gets stuck, let's talk about how to prevent it from happening in the first place, because the best treatment is always prevention. First, make water your best friend. Aim for 6 to 8 glasses a day. Keep a water bottle nearby. Sip throughout the day rather than drinking large amounts at once. If plain water feels boring, try herbal teas, broths, or water with a slice of cucumber or lemon. Second, build fiber into every meal. Whole grain toast in the morning, a piece of fruit as a snack, beans, lentils, or vegetables with lunch and dinner. Slow and steady, your gut will thank you. Third, keep moving. I know joints can ache. I know energy isn't what it used to be, but even small amounts of movement matter. A walk to the mailbox, gentle yoga, chair exercises, anything that gets your body in motion helps your digestion. Fourth, review your medications with your doctor or pharmacist. Ask the simple question, could any of my medications be causing constipation? If the answer is yes, ask if there's a better option, or if anything can be done to balance it out. Fifth, listen to your body. When you feel the urge to go, don't wait, don't hold it, don't say, I'll go later. Holding it in is one of the biggest causes of long-term constipation in seniors. Sixth, manage stress. Yes, stress affects your gut too. Deep breathing, prayer, reading, listening to music, spending time with loved ones, all of these calm your nervous system and help your digestion work better. And seventh, get regular checkups. A simple yearly visit with your doctor can catch problems early. Bring up your bowel habits openly. It's a normal part of your health, just like checking your blood pressure or your cholesterol. My friend, let's take a moment to remember what we've talked about today. Constipation and stool getting stuck in the rectum is one of the most common problems seniors face, but it doesn't have to control your life. By recognizing the warning signs, drinking enough water, eating fiber-rich foods, staying gently active, and listening to your body, you can take back your comfort, your dignity, and your peace of mind. And when home remedies aren't enough, please remember, asking for help is not weakness. It is wisdom. It is courage. It is love for your own body. You have lived a long, beautiful life. You have given so much to your family, your community, and the people who depend on you. Now it's time to give back to yourself. Take care of your body, honor it, listen to it, because every day you feel good is a gift, not just to you, but to everyone who loves you. If this video helped you, or if you learned something new today, please do 3 small things for me. First, hit that subscribe button and ring the bell so you never miss our senior health tips. We share new videos every week, made with love just for you. Second, share this video with a family member, a friend, or anyone you know who could benefit. You might just save them a lot of pain, or even their life. And third, leave a comment below. Tell me, have you or someone you love experienced this? What worked for you? What didn't? Your stories help others in our community feel less alone. Thank you so much for spending this time with me today. Take care of yourself, be gentle with your body, and I'll see you in the next video. Until then, stay healthy, stay strong, and stay blessed.